As nearly 100 million vaccines have been put into people's arms, there are new concerns about variants of COVID-19 that keep popping up. Fox 46's Ryan Kruger spoke with health officials today. And Ryan, one of the big issues is that we don't have a real grasp on the spread of these variants.
Yeah, that's because it's incredibly rare, according to multiple health officials, for a positive COVID test to be looked into further to find out which strain of the virus it is. But thankfully tonight, there is some good news.
The CDC is now projecting that a mutation of the COVID-19 virus will soon be the most dominant form of the virus in the United States. Take the one in California, just recently called a concern. It's considered more contagious and more dangerous once you get it. But there is good news.
The vaccines we have now, the 3 approved vaccines, are very effective against preventing mild and especially severe cases.
Dr. Mark McClellan with Duke University says while the vaccines appear to be working, getting more shots in the near future, that's almost assured.
It may mean going forward that we need to do boosters on those vaccines sooner than we would have otherwise to keep those immune levels, immune responses up high enough.
Positive tests in North Carolina are at some of their lowest rates since last summer. But the big problem is health officials don't know how many of those positive tests are of the variants.
As those variants become more prevalent, we could potentially see numbers going back up. I'm hoping not, but we're doing everything we can.
And Gibby Harris with the Mecklenburg Health Department tells me she's very worried about spring break. She believes people might be traveling, especially to states like possibly Florida or Texas, who no longer have those mask mandates or social distancing requirements, Brian.
Yeah, we've come so far to this point, Ryan. It'd be such a shame to take a step back.